Okay, now this is another NIMH study, and this is time to full resolution, which means basically the person is well enough to go back to work and that sort of thing. With older adolescents and adults, the average time to get there with mania is 11 weeks, and typically you're looking at 2 to 3 weeks in the hospital, maybe a month. With depression, it takes longer, and with mixed states or dysphoric mania, it takes a lot longer. Now, I mean, this is just looking at groups, but to give you a sense for the time frames we're looking at here. And if you compare this to like treating panic disorder, for God's sakes, I want to get people panic-free within 6 weeks, or something that's not being done right, okay? Or with depression. Just the nature of this disorder is it takes a lot longer to really get people back on their feet, okay? These are disturbing statistics, but accurate. Look at this. Full resolution of mania by 6 months, 85% of adults they've gotten there. 14% of children. When I say children, I'm always talking about pre-pubertal children, okay, pre-adolescents. And look at 1 year. And we're going to come back later and look at some more information about this, but this is a reflection of how extraordinarily difficult it is to treat childhood onset bipolar disorder. Okay.
Is that difficult to treat, or is this part of the diagnosis problem? Difficult to diagnose?
Her question is it because it's difficult to diagnose or difficult to treat? And it's both. I'm going to get into some detail about this later. Even in properly diagnosed kids, you do aggressive treatment, the outcomes are not very good, okay? This childhood onset bipolar may be remotely related to bipolar disorder because it tends to run in families, but it is a much more difficult to treat diagnosis. But also, there's a lot of diagnostic confusion as well, okay? Okay, so treatment then is going to be two-pronged. One is you treat the current episode, and of course that's going to be different if you have mania or if you have depression. And then the secondly is relapse prevention, which is obviously essential.